The posterior compartment of the leg is the largest of the three leg compartments. The main action of muscles in the posterior compartment is plantar flexion. Therefore, it is also called as plantarflexor compartment. Today, we are going to learn about the posterior compartment of leg, its subcompartments, and individual muscles in the posterior compartment of the leg. Okay, so it's MedPirates here, and we are back with a lecture of anatomy. So basically, the posterior compartment and the muscles within it are divided into superficial and deep subcompartments by the transverse intermuscular septum. The tibial nerve and posterior tibial and fibular vessels supply both parts of the posterior compartment, but run in the deep subcompartment deep to the transverse intermuscular septum. The superficial subcompartment is large but less confined, while the deep subcompartment is small but more confined. Let's now look at the muscles anatomy of the posterior compartment. There are a total of 3 muscles in the superficial subcompartment and 4 muscles in the deep subcompartment. First, look at the muscles of the superficial subcompartment. We have plantaris, soleus, and gastrocnemius. Plantaris arises from inferior end of lateral supracondylar line of femur and oblique popliteal ligament. The soleus muscle arises from head and posterior surface of fibula, soleal line, and medial border of tibia. Gastrocnemius has 2 heads. Lateral head arises from lateral condyle of femur, while medial head arises from medial condyle of femur. All these 3 muscles are inserted at the posterior surface of calcaneus bone via calcaneal tendon. These muscles are innervated by the tibial nerve, and their main actions are plantarflexion of ankle joint and stabilizing ankle joint, and also stabilizing knee joint to some extent. Okay guys, so now we look at the muscles of the deep subcompartment of the posterior compartment. Below the gastrocnemius, soleus, and plantaris, we have popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. The popliteus muscle arises from lateral surface of lateral condyle of femur and lateral meniscus, and is inserted at posterior surface of tibia and superior to soleal line. Popliteus muscle weakly flexes knee joint and medially rotates tibia of unplanted limb. The flexor hallucis longus arises from inferior 2/3 of posterior surface of fibula and inferior part of interosseous membrane, and is inserted at the base of the distal phalanx of the great toe. It flexes great toe and weakly plantarflexes ankle joint. Flexor digitorum longus arises from the posterior surface of the tibia inferior to soleal line, and is inserted at the bases of distal phalanges of lateral 4 digits. It flexes lateral 4 digits and plantarflexes ankle joint. Tibialis posterior arises from interosseous membrane, posterior surface of tibia inferior to soleal line, and posterior surface of fibula. It is inserted at tuberosity of navicular, cuneiform, and also at bases of 2nd, 3rd, and 4th metatarsals. And here we end up the posterior compartment of the thigh. If you have any questions and if you want the PDF version of this lecture, you can ask me on my Instagram. Subscribe to the channel for more useful lectures. Till then, best of luck and goodbye.